Hey, welcome to Elevation Recovery. This is Matt Finch, and I've got something really controversial and exciting and educational for you today. On May 11th of 2021 on Medscape.com, a new article was published by Pauline Anderson titled, "Opioid Addiction Meds May Curb Growing Problem of Kratom Dependence." However, when I clicked on the article on May 11th, the day it came out, there was nothing there. It said the page didn't even exist. I checked it again on May 12th, and again it said the page is not there. Again on the May 13th, again, page is not there. Finally, when I clicked on it on May 14th, it showed up. Then the article said it was updated May 14th. Here's some quotes from the article. Medications typically used to treat opioid use disorder, OUD, may also be effective for the growing public health problem of kratom addiction, new research shows. Results of a comprehensive literature review and an expert survey suggest buprenorphine, naltrexone, and methadone may be effective for patients seeking help for kratom addiction. And if further research confirms these findings, the indication for OUD medications could potentially be expanded to include moderate to severe kratom addiction. Study investigator Saeed Ahmed, MD, medical director of West Ridge Center at Rutland Regional Medical Center, Rutland, Vermont, told Medscape Medical News. Ahmed, who practices general psychiatry and addiction psychiatry, presented the findings at the virtual American Psychiatric Association APA 2021 annual meeting. Emerging public health problem. Kratom can be ingested in pill or capsule form or as an extract. Its leaves can be chewed or dried and powdered to make a tea. It can also be incorporated into topical creams, balms, or tinctures. Products containing the substance are readily available and legal for sale in many states and cities in the U.S., said Ahmed, adding that it can be purchased online or at local smoke shops and is increasingly used by individuals to self-treat a variety of conditions, including pain, anxiety, and mood conditions, and as an opioid substitute. As reported by Medscape Medical News, a 2018 analysis conducted by the U.S. Food and Drug Administration showed kratom is, in fact, an opioid, a finding that garnered significant pushback from the American Kratom Association. Kratom addiction, said Ahmed, is an emerging public health problem, adding that in recent years the number of calls to poison control centers across the country has increased 52-fold, from 1 per month to 2 per day. He believes misinformation through social media has helped fuel its use. Kratom use, the investigators note, can lead to muscle pain, weight loss, insomnia, hallucinations, and, in some cases, particularly when combined with synthetic opioids or benzodiazepines, it can lead to respiratory depression, seizures, coma, and death. In addition, the investigators note that to date, there are no guidelines on its management. To investigate, the researchers conducted a systematic literature search for cases pertaining to maintenance treatment for kratom dependence. They also tapped into case reports and scientific posters from reliable online sources and conference proceedings. In addition, they conducted a survey of members from the American Society of Addiction Medicine, ASAM. The researchers found 14 reports of long-term management of kratom addiction, half of which did not involve an OUD. It's important to exclude OUDs to avoid possible confounding. In most cases, buprenorphine was used, but in a few cases, naltrexone or methadone were prescribed. All cases had a favorable outcome, Ahmed noted. That buprenorphine maintenance doses appear to be lower than those required to effectively treat OUD. Including kratom addiction as an indication for these medications is important, especially for patients who are heavily addicted, to meet DSM-5 diagnostic criteria for moderate to severe SUD, they add. In addition, the researchers recommend that clinicians consider referring patients with moderate to severe kratom dependence for counseling or enrollment in 12-step addiction treatment programs. Ahmed said he would like to see kratom dependence included in the DSM-5 as a separate entity because it is a botanical with properties similar to but different from traditional opioids. At the end of the article is an editor's note that says this article has been updated for clarity. It also says Ahmed and Levinas have disclosed no relevant financial relationships. What's really interesting is some of the comments at the end of this article. Evans Preston, PharmD, a pharmacist, writes, "I've been a pharmacist for 47 years, so I've seen the pendulum of pain management swing from one extreme to the other. First, undertreating pain for fear of addiction to opioids, then overtreating pain without appropriate consideration of the risk for addiction. The pendulum has now moved back to the undertreatment extreme, but something is very different. Now, providers have a much better understanding of the importance of effective pain management, but also the government is looking over the shoulder of prescribers. Prescribers fear disciplinary or even criminal measures being taken against them if they have patients in the practice who have been prescribed opiates at a higher dose than the government feels is appropriate. Not wanting to risk a loss of livelihood or worse, prescribers sometimes are left no choice but to undertreat or even stop stop treating some of their patients with legitimate chronic pain, even after having patients sign pain contracts. Where do these patients turn? Sadly, some turn to the street for lack of another option. One wonders how many overdose deaths could have been avoided if prescribers were able to effectively treat pain without fear of retribution. I'm thinking that Kratom might provide an avenue to keep patients from turning to underground sources of opiates, which could be laced with all sorts of toxic substances. Of course, Kratom is a drug, but so is caffeine and nicotine. If a provider was willing to educate appropriate patients in the proper use of Kratom, perhaps it could be a deterrent to becoming an overdose statistic of illegally obtained opioids. Next comment from Dr. Haseen Tariq, general practice doctor, says, Kratom is clearly dangerous in killing people with overdose. Its addictive properties are similar to opioids, which we see all the time on our detox unit. Here's another comment from Avenida Escazú, a medical student. They write, the usage of natural remedies such as Kratom and other pure plant herbal treatments are found to be most effective and without side effects. Modern medicines that are created by chemical synthesis, created to imitate a natural product, are manufactured for large profits. The proposal of laws to govern, restrict, and incarcerate is barbaric. It only reflects a need to control other people's behavior. Modern man must be permitted to use personal judgment of which avenue of treatment is best for themselves. Jim Robers, an other healthcare provider, writes, Big Pharma must really be taking care of you! Someone that has their name Nope, No, and other healthcare provider as profession, writes, methadone and Suboxone are so much stronger than Kratom there's absolutely no comparison. The methadone and Suboxone occupy binder receptors far more strongly than Kratom can. The only deaths from Kratom are almost always accompanied by benzo or opiates. If I had been put on methadone, I truly don't think I'd be here today. Dr. Eric Quintero, in the field of psychiatry mental health, while Kratom has an addictive potential that seems to be very low, it also seems to have its own ceiling effect with little respiratory depressive effects. Thus, the number of cases of overdoses without other CNS depressants in the system is very low. You'll notice a mixture of opioid or benzol in pretty much all the cases reported by the CDC. A good number of folks use it successfully for treating chronic pain instead of getting on the prescription opioid train, or to maintain off of opioid or alcohol, using it much in the same way that we use Suboxone or methadone, which has its own abusive potential. Many of these folks may feel wary of institutional medicine, as is unfortunately common in our society today. Some with history of opioid dependence may benefit from closer monitoring and can develop addictive problems. But in general, I believe good public health policy of harm reduction would be to monitor and regulate Kratom rather than prohibition. And then Avenida Escazú, the medical student who wrote another comment, wrote, at Jim Roberts, they, in parentheses, FDA, CDC, other unknown government agencies, end parentheses, are now in the process of direct elimination of Kratom for the source. She then links to an article on kratomherald.com/Indonesian Kratom ban has moved up from 2024 to 2022, and this would cut off the entire supply of Kratom in the United States, but there is some hope. According to MOL, Health Business Administration, they write, there are no confirmed overdoses from Kratom alone. It's been well documented to help opium withdrawal since 1850s. No in vitro or vivo study suggests it causes respiratory depression. In fact, it uses a different cell signaling pathway that doesn't recruit beta-arrestins. 1 in 3, I believe, opioid overdoses are from methadone. Addiction. Qualitative studies have shown addiction potential to be directly correlated to amount used, not length of time consuming. Because it's a partial agonist, much like buprenorphine, it has a ceiling effect, so high doses are somewhat useless anyways. Not that there's a standard physician-prescribed dosing regimen in place to inform people of this. Now I'd ask my healthcare provider of any sort to ask yourself how many people with no prior history of abuse use get addicted to Kratom in small, effective doses, or if there are psychological factors at play here. I'll spare ranting all of my credentials, just dropping this comment here in hopes others see the absurdity of this article. And now you know you're not alone in the disappointment. According to Dr. Sadia Usmani, Family Medicine, Kratom is killing people and causing serious addiction problems. There are numerous reports by CDC and FDA cautioning about Kratom use. It's time to rein it in. It is fueling the problem of existing opioid crisis. They then link to a 2019 article on WebMD saying CDC Americans are dying from Kratom overdoses. According to Jim Robers, other healthcare provider, he writes, FDA and CDC lies for money. Joshua Curry, registered nurse RN, writes, please see the other comments that note that the only recorded cases of overdose were cases of polysubstance abuse. I don't advocate the use of Kratom, but it's drastically less dangerous than methadone. Danny Miller, other healthcare provider, writes, I believe this post is complete blasphemy, just so big pharmaceutical companies and doctors can get people to use pills and treatment because everyone is discovering more natural supplements. I can say personally I've been drinking kava and Kratom for about 5 years and have not experienced absolutely none of those side effects you state here in this article, but good try, shut down big pharmaceuticals, 3 exclamation marks. Sophia Jake, medical student, writes, Kratom addiction is getting worse. We see patients all the time. They end up getting hooked up with synthetic opioids. Methadone and Suboxone are an effective treatment, and it should be introduced before they pick fentanyl. There are multiple reports that people have died while using Kratom along with prescribed medication. Jim Roberts, other healthcare provider, writes, I got high off Suboxone, never on Kratom, and stopped opiates cold turkey in the beginning. I took Kratom 3 times a day, and now only when I'm in pain, maybe once a week. Very addictive! Exclamation mark. Big Pharma created this opiate mess and continue to try to cash in with the help of the FDA and CDC. Then Avenida Escazú, medical student, also writes, at Sophia Jake, acetaminophen overdose is the leading cause for calls to poison control centers at greater than 100,000 per year and accounts for more than 56,000 emergency room visits, 2,600 hospitalizations, and an estimated 458 deaths due to acute liver failure each year. Perhaps Tylenol has a better risk? Jason Early, other healthcare provider, writes, I have a kratom tree growing on my yard. Chewing on a leaf replaces coffee for energy and Advil for pain and inflammation. Yet the science here says I should stop gardening and stop eating plants, especially those that help me, and instead call a legal drug dealer and take hard drugs synthesized in a lab. Makes sense if you're the drug dealer, but how exactly does this make life better for gardeners that choose to eat plants? With this logic, the fact that we don't know what's in the air we breathe, and we clearly show signs of oxygen addiction, we should then seek help and only breathe the air the doctor prescribed, and that air should be made in a lab, marketed and sold. And don't forget to drink your chemicals from your tap. You simply don't know what's in the water from that artesian well. Danny Miller, other healthcare provider, writes in response to the last one, Amen. Well said. And that concludes this video. To the YouTube guidelines enforcers, please note that all I've done in this video is read off of an article and read off of comments. I am not promoting the use of Kratom. I have not shared my beliefs on Kratom. I'm not telling people to go buy Kratom or what kind of Kratom to get or how to use Kratom. This is Kratom news, and this is pretty relevant Kratom news. If you want to leave your comments about this Kratom news, feel free to leave a comment in the comment section of this video. If you haven't already subscribed, I highly recommend it. I make some pretty darn cool videos. Feel free to give this video a thumbs up, and I'll see you on the next video. Take care.